In their 2019 commentary, Lawrence Patihis and Mark Pendergrast delve into the complex issue of recovered memories in therapy, emphasizing the importance of informed consent and the generalizability of their findings. They respond to various commentaries on their original work, discussing the implications of recovered memories and the necessity of informing clients about the malleability of memory. Patihis and Pendergrast argue that informed consent, if properly worded, can prevent harm by making clients aware of the reconstructive nature of memory. They counter concerns from Loftus and Teicher, 2019, that such consent might undermine trust in therapy, suggesting instead that it would empower clients to ask questions about the controversial nature of repressed memories. Cannell, Hudson, and Pope, 2001, also support informing patients about the risks of recovering false memories, which can help clients benefit from evidence-based therapy techniques without falling prey to memory distortion. The authors emphasize that memory distortion in therapy is morally questionable and should be avoided. They compare the use of unproven techniques in psychology to controversial brain surgery in medicine, arguing that clients should be informed of potential hazards. They highlight the severe consequences of memory distortions, such as family estrangement and even suicide, and argue that informed consent can mitigate these risks by educating clients about the malleability of memory. Patihis and Pendergrast address concerns about the representativeness of their sample, noting that they investigated gender, ethnicity, socioeconomic status, and age. They argue that future research should explore reports of recovered memories in other general public samples. Shaw and Vredevelt, in 2019, question whether the US sample findings would generalize to Europe, providing evidence that repressed memory components exist in European psychotherapy practices. The authors discuss the ethical implications of techniques that alter memory, suggesting that cognitive behavioral therapy is a safer alternative. They acknowledge that practitioners might sometimes stray outside typical techniques. Goodman, Gonzalez, and Volpe in 2019 emphasized that memory for traumatic events can be accurate, but caution against reconstructing memories of events that clients did not know happened prior to therapy. Patihis and Pendergrast argue that therapists should avoid encouraging the reconstruction of memories of events that clients were unaware of before therapy. They stress the importance of physical evidence over reconstructed memories in cases of documented abuse. The authors express concern about reappraising real events in ways that damage family relationships, noting that therapeutic relationships are often short-lived compared to parental relationships. In conclusion, Patihis and Pendergrast advocate for informed consent in therapy, emphasizing the importance of educating clients about the malleability of memory to prevent harm. They argue that memory distortion should be avoided and that future research should investigate the generalizability of their findings and the iatrogenic effects of recovered memories. The authors call for careful wording of informed consent to balance the need for client awareness with the preservation of trust in therapy.